My topic is implicit bias for substance abuse, specifically alcohol. So, some popular stereotypes of alcoholics are that they're unreliable, that they're unable to hold down a job or financially dependent on others, or that they're unable to change their behaviors because they simply just don't want to. So, some examples of implicit bias of alcoholics in a healthcare setting would be not providing treatment options because of the expected relapse or the ineffectiveness of therapy. A patient presents with a medical problem that's related to alcohol, but the issue gets addressed, but not the underlying cause, which is the alcohol. Do make sure to do like labs and protocol, and don't make patients wait, because even if a patient comes in and they're presenting, behavioral changes and it seems like they're intoxicated and they have alcoholism on their chart, it could be due to some underlying problem in the body, and it doesn't necessarily have to do with alcohol. Some strategies to try and overcome this implicit bias is self-evaluation. Self-evaluation is very important because I feel like we can't fix the issue until we individually work on ourselves. And if you recognize that you have a bias against alcoholics, then try and work on that, because everyone deserves quality care. Practice mindfulness. This can decrease stress, which can increase emotional control. So I feel like that can be really beneficial to nurses in general or healthcare personnel. Another way is to take perspective of, the other person that you may have a bias against, because nobody asks to be an alcoholic when they grow up. It really is like an illness and not just a character flaw. And that also leads into my next one, which is education. I feel like education is very important because some people just view it as a character flaw and not an illness that is difficult to treat sometimes. And it doesn't just take willpower. Sometimes it takes a whole medical staff and people who are trained to help people overcome alcoholism. Thank you.